Let's talk about red light therapy, other than it just being some this cool color red, right? And it's not just the light red, it's a specific wavelength that we're using to have biological healing and cellular healing in the body. So we do it at a certain wavelength. So the wavelength is from 600 to 700. That's the wavelength of red light therapy. And we have all kinds of different other wavelengths that we use, but they have different therapeutic effects. And we'll be talking about those in the future, like ultraviolet light and blue light and near infrared light and whatever, all these type of different spectrums of light. But red light has a completely different effect than all these based on it being in a different wavelength, and it could have therapeutic action at that. And really, one of our favorite wavelengths that we do to have the effect that red light therapy has on the body, the healing effects that we want, is at 635. So it's not about just using a red laser pointer or just having a red light that you have on the front of your house or whatever during Halloween. Those aren't really going to have therapeutic healing. You have to have it at specific wavelengths. Also, you have to have it at certain power and joules for it to actually have the effect that we want. The home units that you get at like on Amazon or Facebook ads, or you just get for home use, yeah, they do have the appropriate wavelength. There's a lot of research coming out, and a lot of these things are coming out now and weren't before, because it used to be thought that only laser light actually truly had the therapeutic effect. Now we're finding in the research that LED, and now LEDs becoming much more readily available. A lot of products are coming out because a lot of businesses are seeing, oh, wow, this is really good research. A lot of people are going to see great effects on this. This is starting to get advertised a lot. So they're coming out with that. The issue is, yeah, they might be at the right wavelength. I can't say all of them are, but I would suppose that they are. But they don't have high powered units. They're usually mats or pads. Sometimes they're like big panels, and they don't have that many LEDs, and they don't have high powered LEDs that are being used. So they still can have therapeutic action. They can have some anti inflammatory effect, some collagen regeneration effect, anti wrinkle effect that people are looking for. It could even have some hair regrowth that from caps that are being sold out there. So you can have some effect, but they're not going to be that strong and not have the strong therapeutic effect of some of the things I'm going to be talking about just in a sec. So you just need to make sure that you get a high powered unit that has a lot of LEDs, the appropriate megawatts and joules to make sure that it's going to have a strong, long lasting effect. For example, like the bed that I have in my office has 3,500 megawatts of energy power, has 14,500 LEDs, and the joules of really, really high energy there. So they're going to be able to penetrate very deep and treat all cells throughout the entire body. And you're going to be able to do it in a short duration. So if you just use a pad, it's only going to be a localized area. But like comparison between my bed and a pad that you would be doing with not as many LEDs and the megawatts aren't as high, you'll be doing needing to like keep it on for 2 hours for what my bed does in 12 minutes, for example. What does red light therapy actually do when it's actually in the appropriate wavelength of 600 700 or specifically 635? It does so many awesome things. So let's talk about like the basics of it. What it does is it works on the mitochondria of the body. So whenever you have that light penetrating inside a cell, it's stimulating complex 4 of your mitochondria, more specifically cytochrome C, which is needed for your body to make ATP. So when you improve ATP production inside a cell, that means that cell is going to work better and it's going to be able to regenerate and heal. So a lot of times eczema could possibly be related to a chronic infection. It's not just an autoimmune reaction. It could be a chronic infection causing that eczema, and the red light therapy is good on killing off that infection that might be in there, like staph or other infections that might be on the skin. Let me go back a little bit. Let's talk about like what is the importance of the mitochondria. The mitochondria is the working engine in our cell. So main aspects of the cell I like to talk about is the nucleus and then the mitochondria. The nucleus, I like to say, is the foreman. It's sending a signal and sending instructions saying, hey, this is what you need to do. And the mitochondria is actually the little workers, factory workers doing the work that's being instructed by the nucleus. So if you have a mitochondria that's not working well, you're not going to be able to make whatever needs to be made. Like the foreman's like, okay, here's the instructions. We need to make this product. But if the workers are lazy and not working or they're sick, that work is not going to get done. So the mitochondria is needed for all that work to happen. And there's so many things that damage the mitochondria, like is in our world today. We have so many chemicals, we have heavy metals, we have chronic infections like viruses, and all kinds of things damaging this mitochondria. So a lot of us have mitochondrial trauma. So it's really great that we could have a therapy that works so strongly on the mitochondrial. Let's dig deep into autoimmune disease and what red light therapy does for it. So, autoimmune diseases attack certain areas of the body. It's the immune system being dysregulated. It's cross-reacting with certain proteins, and we give it certain names. Rheumatoid arthritis attacking the joints, multiple sclerosis attacking the myelin sheaths, Crohn's disease, it's attacking the large and small intestine, ulcerative colitis attacking the distal aspect of the large intestine. So these are all major common autoimmune diseases that are treated very effectively with red light therapy. So, what does it do? First, let's talk about the anti inflammatory effect that red light therapy has. It works directly on certain prostaglandins. Prostaglandins are inflammatory mediators. It helps decrease inflammatory cytokines that are made. It also decreases COX2 enzyme. These are all aspects of the body that leads to this inflammatory response that leads to the chronic pain that people experience or the neurological issues that people experience with multiple sclerosis. So the chronic diarrhea or whatever that is experienced with Crohn's disease is caused by that inflammatory response. But red light therapy, without any side effects whatsoever, can actually modulate those inflammatory response and decrease that. And what's also really cool about it is there's trauma that comes along with autoimmune disease, right? The immune system is attacking and destroying tissue. But what's great about red light therapy is actually can stimulate regeneration and healing of tissue. We talked about the mitochondria, how it gets stimulated, right? And that's how tissue heals. Cartilage is made up of mitochondria, ligaments are made up of mitochondria, brain tissue is made up of mitochondria, muscle tissue, everything is made up this mitochondria. So how do we regenerate and heal these tissues is stimulate the mitochondrial function. So through stimulating the mitochondrial function with red light therapy, which is a great therapy because it's one of the few that actually is able to penetrate deep through the skin. Other spectrums of light are not able to do that. It's only red and near infrared light that are even able to penetrate through the skin like 4.5 centimeters. So it could go deep. It could actually go into the liver. It could go into the GI tract, like the small intestine, the large intestine, go into the prostate. It could go through the skull bones and actually get into the brain if you get an appropriate helmet and with the right power to actually have this regenerative effect to help with all these various autoimmune conditions that happen in people's bodies. So we're not only getting the anti-inflammatory effect, we're getting the regenerative effect also. I also want to dive into the antimicrobial effect of red light therapy, which is really great too, because a lot of times what I see the cause of autoimmune disease is many times people have these chronic infections, chronic Epstein-Barr virus, chronic Lyme disease, chronic strep, mycoplasma pneumoniae, etc. So red light therapy has an antimicrobial effect to it and helps improve your immune system function also to be able to kill off these infections. It has so many different ways it's helping with the autoimmune conditions. So I always recommend red light therapy to my patients with autoimmune conditions because it's so powerful, has very little side effects at all, and people can really start feeling better quickly when we start doing red light therapy on patients. What are some of the symptoms that patients with autoimmune disease deal with and red light therapy actually helps with? So a big one is almost every autoimmune patient deals with some type of chronic pain. It's either in their joints, it's either in their GI tract, it's either in their nervous system. It all comes down to they experience chronic pain. So red light therapy is really great on decreasing inflammation, which helps with the pain, but it also has some direct effects on healing the nervous tissue, which gets inflamed and angry, but also we're able to regenerate and heal that nervous tissue throughout the body. So it can help with the pain. Also, a lot of patients with autoimmune disease, almost all of them, have chronic fatigue. They feel tired all the time. They have the general malaise, and they don't feel well. So we talked about how red light therapy stimulates mitochondrial function, which leads to ATP production, which leads to more energy. So the body's able to get a lot more energy production. So it helps perk up a patient with autoimmune disease and not have as much fatigue, and they have a lot more energy. Also, it helps improves brain fog, very common thing that patients with autoimmune disease deal with too. So those are just a few of the things that red light therapy can help with patients with autoimmune disease. Let's talk about is like, do I use just red light therapy when I go after autoimmune disease? No, I don't just use red light therapy for that. It's a strong tool, but if all I did was red light therapy, you're not going to really treat the true cause of what's going on. Now, we are treating the inflammatory process, but what is causing that inflammatory process? So, you need to come in and get a detailed diagnosis from a doctor to really identify what are the causes of autoimmune disease. Because if you don't identify that and all you do is red light therapy, is you just have to get red light therapy forever. But we don't want someone to have to depend on something forever, right? So what we want to do is really identify the true causes with autoimmune disease, which is various. We've talked on other videos about the causes of autoimmune disease, but I'll just go real quick. Like I said, chronic infections, toxic exposures, food allergies, guts that are inflamed and imbalanced, mycotoxin, mold exposures, etc. These are some quick understandings of what could possibly causing autoimmune disease. So you have to take care of those. You need to treat those with red light therapy. So I use red light therapy as a tool, but it's not my only tool to get autoimmune disease under control. We have to take care of the causes, use red light therapy to decrease inflammation, regenerate and heal the body. But if all I did was red light therapy, you wouldn't be totally cured of your disease. If you want to learn more about treatments for autoimmune disease, click my videos to the right. I'm Dr. Jake, and I'll see you there.